This is Dr. Stephen Harkins. Welcome to page 57 of Anatomy Coloring Book. The movers of the hand joints, the intrinsics, these are the ones that are found with all the origin insertion found within the hand, as opposed to the muscles that we learned about on page 56, which came from the forearm and into the hand. These are the intrinsic movers. Let's start with the Dinar Eminence. The Dinar Eminence is this pad, this fleshy muscular pad that you can feel right here on your hand, on the palm of your hand, called the Dinar Eminence. And the first muscle there is Opponens Pollicis. Opponens Pollicis. This is the muscle, again descriptive. It brings your thumb to the opposite side of the hand, as you can see in this diagram here. Opposition, it's called. And that's this muscle on the outside of the Dinar Eminence here. And it originates from the trapezium bone of the wrist and inserts at the base of the first metacarpal. And of course, pollicis means thumb and opponens means opposite. So there you have your action. It brings the thumb to the opposite side, as stated before. The Opponens Pollicis, this is the proximal phalanx, not the metacarpal. The Opponens Pollicis muscle actually inserts on the shaft of the first metacarpal, which would be right here. Not to the base, not at the base of the metacarpal. Now moving on to the Abductor Pollicis brevis. Abductor Pollicis brevis. It's this most massive of the Dinar muscles, originating from the trapezium and scaphoid bones and the flexor retinaculum. This stretchy sort of ligament found here. And by the way, the Opponens Pollicis also originates there, as well as the bones. And originating at the scaphoid and then inserting right here, as you can see, at the base of the proximal phalanx of the thumb. And of course, its action is to abduct. This action right here, to bring the thumb inward toward the midline of the body. And next, the Flexor Pollicis brevis. Flexor Pollicis brevis. It's going to flex the thumb, and it's going to be short. Brevis means brief. And here it is, as compared to the Flexor Pollicis longus, which comes from the forearm. And similarly to the other two thenar muscles, it originates at the trapezium, this little bone of the wrist down here. And it inserts also at the base of the proximal phalanx of the thumb, or the first digit. And of course, its job is to flex the thumb. This action right here, flex the thumb. So right here on the thenar, we have an abductor, we have an opposition, an opposer, and a flexor abductor and an opposer. And let me make a correction about Abductor Pollicis brevis. This is a deduction. This is the action of Abductor Pollicis brevis, bringing the thumb outward away from the midline. Away from the midline. Now, that was the muscles of the Dinar Eminence, but there's another eminence, the Hypothenar Eminence. Hypo means smaller. It's on the pinky side. It's this fleshy pad right over here. There are three muscles of the Hypothenar Eminence, starting with Opponens Digiti Minimi. And that's going to be this muscle right here that is going to bring the pinky close to the thumb. And you can see it right here underneath some cutaway muscles, which we will discuss. And as I said, its action is opposition, bringing inward to join the thumb. It originates on the hamate bone, the hook of the hamate, underneath all of this down in here, and then inserts at the base of the metacarpal, or at the metacarpal of the fifth metacarpal, the pinky bone, of course. And you can see it's uniquely positioned to bring the pinky across this way to meet up with the thumb in that Opponens motion. Abductor Digiti Minimi. This muscle right here, and as it says, going to abduct, AB, abduct, and here it is cut away, so it's over the top of the Opponens Digiti Minimi, Abductor Digiti Minimi. And you can also see it here making up the sort of the bulk of the fleshy part of the hypothenar on the pinky side of your hand there. And of course, it is going to, as stated, it's going to abduct. It's going to take the pinky and bring it outward like that in the anatomical position, which will be, which would actually be, well, away from the midline of the hand. So that's Abductor Digiti Minimi. This motion here. Flexor Digiti Minimi Brevis, as the name states, will flex what? The digit. Which one? The smallest one. And it's short. It's inside the hand. It's an intrinsic muscle. And that's right here. Flexor Digiti Minimi Brevis. This is the anterior palm. This is the palmar view. And let's see here. It also originates from the hook of the hamate bone, which would be down here in the wrist, and inserts at the base of the first of the proximal phalanx down here, right in here. And of course, its action is going to be to pull the pinky, or the fifth digit, into flexion to help it close and grasp in the wrist. Now, the deep muscles, the deepest muscles of the hand, we'll start with Adductor Pollicis. The Adductor Pollicis. Well, as you can see, very descriptive word. What it is going to do is adduct the thumb right here. And you can see it as this large muscle right in here, beautifully positioned to pull the thumb into adduction. Adduction towards the midline. Adduction. And another look at it here. Inserting at the base of the first metacarpal of the thumb. Adductor Pollicis. And this is, you can definitely feel this in between your thumb and forefinger, your thumb and index finger. That big fleshy muscle there is your Adductor Pollicis. It originates from the second and third metacarpals. So here's a metacarpal bone right here. the second and third. Also this one here underneath, you can't see it originating. And then inserting out here on the base of the proximal phalanx of the thumb. Powerful muscle to bring inward, to bring the thumb inward toward the midline of the hand. The palmar interosseous muscles are found deep in between the metacarpals. You can feel those if you squeeze your fingers together, as in this picture here. Let's see, which color? Let's go with blue. This picture right here, you can see in between the metacarpals and then originating in the metacarpals and then inserting at the base of the proximal phalanx. You can see their job is adduction, bringing the swinging the fingers inward toward the midline. And here they are. Here's another picture of them right here. And in between the metacarpals, inserting on the base of the proximal phalanx of the digits. And the job, of course, is adduction. These are the palmar interosseous muscles. They're in the palm. Interosseous means between bones. So they're on the palmar side of the palm. They're in between the bones and they adduct. Now, the dorsal interosseous muscles, they would be on the back side of the hand, dorsal side of the hand. And they are also in between bones, And that's these right here. Well, we'll look right here, these muscles here, originating on the metacarpals and inserting on the phalanx, the proximal phalanx of the digits. And actually that. And their job is to abduct, or to bring the dorsal or interosseous. The job is to bring the fingers away, to spread the fingers out wide. So the dorsal interosseous are abductors, while the palmar interossei are abductors. And lastly, we have the lumbrical muscles, the lumbricals. The lumbrical muscles. Also found here on the palmar side here, kind of in between the metacarpals and whatnot. But they are very unique. They originate from the actual tendons of the Flexor digitorum profundus muscle. So you can see them coming off of the tendons, these long tendons of Flexor digitorum profundus, and then they will insert, wrapping around to the other side of the hand, to the extensor tendons of the back of the hand. So that would create a stiffness of the hand, being able to come off the flexor tendon and then wrap around and get involved in extension of the hand. That would be these tendons of the extensor digitorum here. The lumbricals would actually wrap around and assist in this extension of the fingers. And that concludes the lesson on page 57 of Anatomy Coloring Book, The Movers of the Hand Joints, the Intrinsic Movers. This is Dr. Stephen Harkins.